We're going to be talking about gut microbiome, vaginal microbiome, all through a woman's lifespan. And we're going to be talking a little bit about Tiny Health and how you can use our test to help assess these different stages in a woman's life. So let's start off by talking a little bit about Tiny Health and who we are. Tiny Health is woman founded, woman owned, and it really came out of our founder Cheryl's two different birthing stories. The first, she had a C-section baby. Baby went on to develop a sesame allergy, some colic, some sleep issues. And second baby was a vaginal born baby who did not experience any of these same symptoms or conditions. So she really got to work researching, looking through PubMed, trying to figure out why the C-section baby ended up with these symptoms and conditions. And what she found is there is a very strong link between C-section and gut disruptions early in life and having atopic March conditions later in life, like eczema and allergies and asthma. And in fact, about 60% of our testers do come to us because of eczema. And as a result of this, she put together a team of experts, and Tiny Health was founded. We just celebrated our third birthday. Here are a few of our medical advisors that you might recognize. Elisa Song is our chief medical officer and expert in the pediatric field, and we just signed on Imran Mayer as we move more into the adult market. We're excited to have him. We have basically three products. Today, I'm going to be talking about the gut health test and the vaginal health test. The ProGut test is the same as the gut test. It just has additional stool chemistry markers. So if you're used to markers like calprotectin and secretory IgA and short-chain fatty acids, the ProGut test is the combination of our gut health test along with those stool chemistry markers. So it will apply today as well. A few features about Tiny Health before we jump in is that it is age adjusted. So we have these age adjusted reference ranges and metrics. This is extremely important, as we'll learn, for pregnancy and babies and toddlers because their microbiome is very different than that of an adult. We also have separate metrics for these different populations because these different populations have different needs. And I'll show you in a second what some of those metrics are. We also utilize shotgun sequencing. This is really important for us because it not only tells us who is there and gives us a complete readout of the microbes in the microbiome, but it measures functional pathways. So I'm going to break this down a little bit for you. With a lot of testing technologies like PCR, for example, you ask, is this here or not? Is this microbe here or not? It says yes or no, but it can't really scale to the point where it can give you a complete readout of everything in the microbiome. And that's what we can do with shotgun sequencing. It is also able to tell you what these microbes are doing. So sometimes we may infer functionality based on taxonomy, meaning that if we see we have bifidobacteria, we may say, oh, then we probably have good acetate production because that's one of the functions of bifidobacteria. But with shotgun sequencing, we actually can look at these pathways through genes of these microbes to know if we have the genes and the pathways in this microbiome who can perform that function. And we're going to be talking a lot about those functions today. We also do have the pro stool chemistries that I just mentioned, and we are priced for repeat testing. We believe it's really important that you test, that you implement your protocols, but then you retest to make sure that those protocols are working and that you don't need to change anything up. This is super important during pregnancy and the first 1,000 days of life. And we also offer practitioner results interpretation support. Honestly, our test is almost a self-guided experience. If you are new to testing, Tiny Health is a great place to start because we provide all the education and built-in recommendations. However, if you want that extra mentorship and guidance, we have specialists who can meet with you and help you interpret results and learn how to interpret results. Here's an example of our age-related metrics. And you can see that some metrics like HMO digestion that we'll talk about, we have these for pregnancy and we have these for babies, but Adults who aren't pregnant do not necessarily need to know if they have HMO digesting, so that won't be included. And that's just one example of some of these metrics that will be different depending on the age group and the population we're looking at. So we're not only age adjusting the reference ranges, but we're offering you information that is very specific to the population that you're testing. So let's get into gut microbiome and vaginal microbiomes throughout the lifespan. Here's a very high level overview of the changes in the gut microbiome throughout a woman's life. Initially, through birth, we hope that we have a vaginal birth and we're breastfed, and we're going to be seeded with lactobacillus from the vaginal microbiome, bifidobacteria from the gut microbiome. And then in this graphic, you can see over the years how diversity changes. That's what all these little different colored dots are at the top. Early on in life, we want little diversity. That means different types of microbes. As we age into adulthood, we want a lot of diversity, a lot of different types of microbes. But then as we get into the later years, we go back to like we did at the beginning and we have much less diversity. Now, a lot of times these are different microbes, but it is less diversity like it is in infancy. The vaginal microbiome, on the other hand, we want low diversity throughout the lifespan, but who is there changes. And when we have more diversity, that usually sets us up for something like bacterial vaginosis. But the vaginal microbiome closely follows estrogen levels. So when estrogen rises, so will lactobacillus. And lactobacillus is the most important bacteria in the vaginal microbiome. When estrogen drops, then so does lactobacillus, and that allows for more diversity and other microbes to come in. So during childhood and puberty, we have low estrogen and low lactobacillus. In the reproductive years, we have higher lactobacillus, a more acidic pH. And then into perimenopause and menopause and post-menopause, when estrogen drops, so does lactobacillus. So we're talking about gut microbiome and vaginal microbiome, but these microbiomes don't exist in isolation. How many of you have ever heard of the gut everything axis or the gut x-axis? This is really a bidirectional communication system between the gut and intestinal, I love that word, extraintestinal organs, so organ outside of the gut. And this is how the gut communicates with these organs, and these organs communicate with the gut. And the gut reproductive axis or the gut vaginal axis is one of those axes that we're going to talk about today. So how does this happen? We see the picture of the gut in the middle and it communicates with all these organs, but how does it do that? I like to put this in visual form so we understand as we're going through the process and the mechanism by which it's happening. Here we have a little infographic of a healthy gut and an unhealthy gut. So this is where it starts. And we have this one layer thick lining, our intestinal barrier, and it separates what's happening on the outside world from the inside world. And what I mean by that is I consider this the outside world. So whatever is happening in your gut, this is where food comes through. This is where we have our microbiome and our microbes and their different metabolites. This is where toxins come in. Now, one of the jobs of this intestinal barrier is to allow the things that we want into our body in and to keep other things out, antigens that we don't want in our body. So in a healthy intestinal barrier, these junctions will open and close and allow for helpful metabolites to come through. And when they do, they get into blood flow, which is what we see right here. And this travels all over the body to all those organs that we just saw. So that's how what is happening in the gut happens in other organs. That's how we're communicating here. On the other hand, if we have a lot of inflammation and dysbiosis in the gut, then we're going to have a lot more toxins and leaking into the systemic circulation, into that blood flow, and traveling all over the body, creating inflammation all over the body. So these axes, they are bidirectional, and that's true for the gut and the vaginal microbiomes. Because the rectum and the vagina are so close together in proximity, they both serve as reservoirs for these microbes, and they exchange microbes. They also communicate through the immune system, and inflammation in one is going to create inflammation in the other, and they both help with hormonal regulation. We'll talk more about the estrobolome next. They also communicate with each other through metabolite exchange. One of these is lactic acid. It's produced in the microbiome, but it affects the pH in the gut microbiome, and short-chain fatty acids and different metabolites that are produced in the gut also will impact the vaginal microbiome. How many of you have heard of this concept of the estrobolome? A lot of us are familiar with beta glucuronidase, but estrobolome is something that is definitely being talked about more and more these days. And it's really this collection of microbes who produce beta glucuronidase and help with estrogen metabolism. So, beta glucuronidase is that enzyme that deconjugates estrogen as it's packaged up and ready to leave the system. And it helps to regulate estrogen levels by choosing when to increase beta glucuronidase and release estrogen back into the system and when to hold back a little bit. But you can have imbalances in this beta glucuronidase and in this estrobolome. And if it's really high and we're producing too much beta glucuronidase and releasing too much estrogen back into the system, then it can lead to conditions because of estrogen dominance. It can also play a role in conditions like osteoporosis, metabolic syndrome, cardiovascular disease, and vaginal atrophy in postmenopausal women. So it becomes an issue if it's too low in the menopause years. So to help illustrate each of the different milestones in the vaginal and gut microbiome throughout life, we're going to follow Emma on her journey from puberty all the way through menopause. And we're going to start here with puberty. As estrogen starts to rise, she also has lactobacillus in her vaginal microbiome that starts to increase, lowering the pH. This helps to protect against infections and supports her reproductive health. The gut microbiome at this stage is pretty mature and it's largely stable, but it's going to be influenced heavily by her diet and lifestyle factors. She experiences the typical challenges of adolescence, which include acne and mood swings and new body changes, some of which are influenced by her evolving gut and vaginal microbiomes. For time's sake, I'm not going to go through this right now, but you have it in your slides. There's also the gut-skin axis and some of those changes that are occurring during puberty and how they are impacting the microbiome directly can impact acne. So you can read through some of these mechanisms when you have the slides. Now, I talked about this connection between estrogen and lactobacillus. So I want to go through or break down the mechanism behind that. Anytime you see VM, that means vaginal microbiome. GM is gut microbiome. So glycogen is this large branched polysaccharide that serves as the major storage form of glucose. It's found in different parts of our body. It's found in the liver, the muscle cells, the brain, the uterus, and the vaginal epithelium, and it serves as a readily available energy source. Estrogen stimulates glycogen synthesis in the epithelial cells and activates the key enzyme that's needed for glycogen synthesis. And then lactobacillus comes in and it breaks glycogen down and uses it to produce lactic acid, which helps to maintain a healthy acidic vaginal environment. I mentioned lactobacillus several times in relation to the vaginal microbiome, so let's talk about why it is a key player in vaginal health, and specifically Lactobacillus crispatus. It is linked to the production of lactic acid. We want a very low pH, less than 4, in the vaginal microbiome to prevent pathogenic infections. This low pH makes it inhospitable to pathogens. It's like throwing acid on them. It just kills them off. They can't grow there very well. Lactobacillus crispatus also helps with hydrogen peroxide production, which has antimicrobial properties and can directly kill or impact the growth of harmful bacteria. A microbiome that's dominated by Lactobacillus crispatus is more stable throughout a woman's menstrual cycle. So the microbiome does shift throughout the menstrual cycle. It becomes a little bit more dysbiotic before menses and through menses. But if the microbiome is predominantly crispatus, it will be a little bit more stable and less inflammatory. Crispatus also does help to lower inflammatory cytokines, and it's associated with the lowest risk of gynecological and obstetric complications. So if you have used a vaginal microbiome test before, and I'm interested to know how many of you have seen a vaginal microbiome test, these are different than your typical qPCR test that look for certain infections. Again, with those tests, we're looking to see if this pathogen is here or not. But what that is missing is the overall state of the microbiome. As you'll see, it's really important that we have enough of the beneficials like lactobacillus if we ever want to compete with things like Gardnerella. So these vaginal microbiome tests will look at the complete picture of the vaginal microbiome. In addition to the pathogens, do you have enough of the beneficials, which is really what we want to see. And these vaginal microbiome tests are broken down into community state types. So you will have a either community state type 1 or 1, 2, 3, 4, or 5, depending on who is predominating your gut or your vaginal microbiome. So here's some examples of these. Community state type 1 is dominated by Lactobacillus crispatus, community state type 2 by Gastro, community state type 3 by inners, and we have an example here of inners. What is interesting is this can be considered healthy, it can be considered unhealthy. I always say that inners has an identity crisis. If there are other pathogens around, then it decides it wants to be a bad guy. If there's other beneficials around, it decides it wants to be good. So in this example, we have a lot of variables. These are opportunistics. We have a lot of disruptive pathogens. We have very little protective. So here it is acting like a bad guy because that's who else is in the environment. Community state type 5 is dominated by Lactobacillus jenseni. And then community state type 4 is usually considered very dysbiotic. We usually have low lactobacillus, high diversity, and a lot of other microbes there who tend to be more pathogenic. This is what we typically see in bacterial vaginosis. So we might see Gardnerella here, aerobic vaginitis, urinary tract infections, group B strep, infertility, preterm birth. And this is also what we would probably expect going through menopause and postmenopausal. You've probably heard a lot about gut disrupting factors, but here's a list of vaginal disrupting factors. And just like gut disrupting factors, there are a lot of them. So a lot of us are going to be impacted by these. Antibiotics and other medications, just like the gut microbiome. Hormonal fluctuations, including the menstrual cycle, pregnancy, and menopause, can lead to vaginal disruptions. Contraceptives, feminine hygiene products, menstrual products, sexual activity, smoking and alcohol, suboptimal diet and lifestyle, and gut dysbiosis. So again, probably a lot of us have experienced these, and it's why so many of us do experience vaginal microbiome dysbiosis. So let's get back to Emma. Emma graduated high school. She went to college. She experiences stress, alcohol, poor diet, and antibiotics. She becomes a party animal and just does all the things that someone in college would do. And as a result, she has ended up with some IBS symptoms and bacterial vaginosis. And I wanted to just give you this little pattern of what it might look like for someone with IBS and their gut microbiome and bacterial vaginosis and the vaginal microbiome. So with the gut microbiome, IBS can be tricky. Sometimes we can't see it at all in the gut microbiome, and I have my own theories around that, but sometimes we can. And we do have an IBS signature, and this is typically what we see in our users and what we typically see in research that happens with the gut microbiome and the IBS process. And one of those is decreased actinobacteria, and that's because bifidobacteria is a big part of actinobacteria, and it produces lots of healthy metabolites. We might also see decreases in Shannon diversity and short-chain fatty acids, and we would see an elevation of hexa-LPS, mucus degradation, and pathogens like dysentery and streptococcus. So we've got low levels of beneficials, high levels of pathogens, and lots of inflammatory molecules happening here. And if you aren't familiar with hexa-LPS, it is a toxin that is produced by gram-negative bacteria. It's very inflammatory to the intestinal barrier. And then if you remember that graphic I showed you where leaky gut, we have these different antigens and toxins leaking into systemic circulation. When this LPS gets through that leaky gut into systemic circulation, it goes to all those extra intestinal organs and can create inflammation there as well. With the vaginal microbiome and bacterial vaginosis, we would look for community state type 4. That would mean it would have decreased lactobacillus and elevated opportunistic or pathogens like vaginalis and prevotella. And remember that this is bidirectional. So this inflammation that's coming from her IBS and coming from her bacterial vaginosis is just playing off each other and leading to more inflammation in the other microbiome. Now Emma has graduated university. She began her career as an attorney and she meets Mr. Wright. Mr. and Mrs. Wright have challenges conceiving, and while working with a fertility expert, they consult a functional practitioner who utilizes gut and vaginal microbiome testing. And she wants to teach them a little bit about why the gut and vaginal microbiomes are so important in fertility outcomes. The gut and the vaginal microbiomes are really integral to female reproductive health, influencing fertility and pregnancy outcomes. Two of the reasons why are because, as we saw, they both influence inflammation and they both influence hormone levels. Disruptions in the microbial balance can impair conception and increase the risk of complications, even in women without obvious reproductive issues. Both natural conception and assisted reproductive technologies like IVF are affected by the microbiome's composition. Now, lactobacillus dominated environments are associated with higher fertility, increased embryo implantation rates, and a greater IVF success. Vaginal imbalances, including low lactobacillus or elevated pathogens, are associated with worse implantation rates and clinical pregnancy rates in IVF, and pro-inflammatory dysbiosis is associated with an increased risk of TIs, including HIV, PID, preterm birth, and progression of HPV. And I like how this little graphic shows how if you have a healthy vaginal microbiome and you're exposed to HIV, you're less likely to end up with HIV than if you have a very dysbiotic microbiome. You're more likely to contract HIV because of that dysbiotic microbiome. Now, let's talk a little bit about bacterial vaginosis. The BV rates in the United States are almost up to 50%. So 29 to 49% of women experience bacterial vaginosis. And some studies show that bacterial vaginosis doubles the risk of miscarriage in the first trimester, one extra miscarriage for every 6 women with bacterial vaginosis. So here we start to paint a picture of why it's so important to be screening women with fertility issues or those who want to become pregnant in order to help minimize the risk of miscarriage because the rate of bacterial vaginosis is so high. Now, the gut microbiome and the vaginal microbiome are not the only microbiomes that are important here. Cervical canal, endometrial, and follicular microbiomes also influence fertility. However, the vaginal microbiome impacts these upstream microbiomes. Vaginal dysbiosis can damage the cervical epithelial barrier, allowing bacteria to move into the endometrium. And some research has shown microbes in vaginal swabs that were detected in follicular fluid samples. We already talked about how the gut-vaginal crosstalk via hormones, microbes, and the immune system. But the gut microbiome can also impact reproduction through nutrient metabolism and metabolic health. The next few slides will focus on nutrient metabolism, so I want to focus a little bit here on metabolic health. The gut microbiome can influence insulin sensitivity through inflammation, and this facilitates the hypothalamic pituitary gonadal axis and supports optimal levels of hormones like gonadotropin-releasing hormone, FSH, and LH, and it supports optimal ovarian sterogenesis. So in addition to estrogen metabolism and the estrobolome, the gut can in fact produce and modify other hormones, including progesterone and follicle-stimulating hormone. Now, I went off on a rabbit hole when I was doing this presentation, and I wanted to know how it impacts the male microbiome and how the male microbiome can impact fertility. So I added one slide here and I restrained from creating a whole new entire presentation. But the gut microbiome for the male reproduction will impact modulation of sex hormones, insulin sensitivity, immune system, and testicular microbiota in men. In addition, the gut microbiome of men is a little bit different than women. There are some studies showing that men typically have more prevotella because of the higher testosterone levels. And there's also research showing that women with PCOS who have higher testosterone levels also have higher prevotella levels. So if you are looking at a gut microbiome test of a woman with PCOS and she has higher prevotella, it might be because of the elevated testosterone. So Emma's functional practitioner recommended a vaginal and gut microbiome test through Tiny Health to help guide some recommendations. And she really wanted to see on the vaginal test if there was enough lactobacillus and screen for any dysbiosis that could be increasing the risk of miscarriage. And she wanted to test the gut microbiome to evaluate diversity and estrobolome to see how it might be impacting estrogen levels. And as a result, she prescribed or recommended a few very targeted probiotics and for the vaginal microbiome, Lactobacillus crispatus and rhamnosus to help balance the lactobacillus levels back out in the vaginal microbiome. Now, Emma's expecting, and during pregnancy, Emma's vaginal microbiome becomes even more lactobacillus dominant, lowering infection risk for her and her baby. Her gut microbiome shifts to support fetal development, but may also contribute to common symptoms like constipation or nausea. And Emma learns that supporting her microbiome through diet, probiotics, and lifestyle can fit both her and her child. However, pregnancy changes the gut microbiome because of a lot of physiological changes that are happening. So during pregnancy, we have decreased muscle tone across the digestive tract, delayed gastric emptying, reduced gastric motility, and increased production of pro-inflammatory cytokines, as well as changes in biocomposition. This can impact and increase those pesky GI symptoms like nausea and vomiting and constipation. And in turn, these symptoms change eating habits. And when eating habits change and digestion change, then we change the microbiome. Digestion is really important for determining how the microbes in our microbiome get fed and what the pH level is there. And different microbes like to live in different pH levels. So this isn't only important as trying to help women that are having all these GI symptoms. A lot of times it seems very annoying that they're having these GI symptoms and we want to help them feel better. But also these GI symptoms can really impact their microbiome. And as we see, that's going to impact what metabolites are being produced for baby. Elevated progesterone levels also impact the composition of the gut microbiome. And that is because bifidobacteria contains an enzyme called hydroxysteroidehydrogenase that is involved in progesterone metabolism. And there's a larger proportion of bifidobacteria and proteobacteria in pregnancy and reduced alpha diversity. And as we go through the infant section, you'll see that this starts to match what the infant's microbiome looks like. So the maternal microbiome starts to shift to look like what we want baby's microbiome to look like. Beta diversity and abundance of opportunistic pathogens are elevated, and these changes influence maternal metabolism, which impacts the development and growth of fetal organs. So Emma has a follow-up with her functional practitioner, and she wants to know how supporting her microbiome can support her developing baby. So let's talk about the first 1,000 days and the impact of maternal gut microbiome on fetal development during pregnancy. And those first 1,000 days do start at conception and go to about the age of 2 years of life. We need to make sure that when we're thinking about baby's microbiome, we really start thinking about it during conception, not after baby is born. And just one of the major highlights of this section is the importance of gut metabolites. So we usually look for certain microbes. Are there pathogens that are elevated? Do we have enough beneficials? But the reason they are so important is because what they're actually doing in the gut. It's those metabolites they're producing. They take in the food that we eat, they ferment it, they give off these byproducts, they give off toxins sometimes. And depending on who is there, what they're eating and what they're doing, this can either be beneficial or harmful for us. So these gut microbiome metabolites pass from the gut lumen to the circulation. They access the fetus through the placenta, reach fetal circulation, and provide nutrients required for fetal growth and development. Some of these metabolites can cross the fetal blood-brain barrier and are involved in fetal central nervous system and immune system development by regulating dendritic T cell function and cytokine production. The gut microbiome also produces vitamins. As a dietitian, I thought this was really cool the first time that I found this out, because many years ago when I was in school, they were not teaching this and they did not know this. However, these microbes in our colon are actually producing vitamins, and they do it to crossfeed each other and selectively choose who lives with them. But they also do it because we have this symbiotic relationship with them, and we can absorb and utilize a lot of these vitamins that they are producing. And I get asked a lot about how this relates to genetic mutations and the MTHFR. Well, the good thing is when it comes to folate production, one of the most common forms of folate that the gut bacteria are producing is 5-methyl THF. And this is easily processed and absorbed by the intestinal epithelium. It does cross the placenta, supports the fetal DNA synthesis, neural tube formation, and brain development. So another excellent reason to check mom's gut microbiome to make sure that she has the functional pathways and the bacteria there who are producing folate for baby. Now, in gestational diabetes, there is research showing that is connected to gut dysbiosis, including decreased bifidobacteria and increased proteobacteria. Dysbiosis and endotoxins like LPS do result in low-grade inflammation, which again results in insulin sensitivity, and babies' increased exposure to glucose and higher levels of fetal insulin can result in larger than average newborns. So, gut dysbiosis can lead to gestational diabetes and larger than average newborns. One of our favorite gut metabolites are the short chain fatty acids, acetate, propionate, and butyrate. And during pregnancy and fetal development, they play many important roles. And here are a few of them. They help to support insulin sensitivity, support fetal blood-brain barrier formation and brain development. They contribute to immune development, those T cell development, dendritic cell activity, and epithelial integrity. They regulate the fetal gut epithelium, act as epigenetic markers. They are a source of energy for the fetus, and they help to program the fetal metabolic system. So I want to talk about a few other metabolites that are really important in addition to the short chain fatty acids. And one of them is indole 3 propionic acid, IPA. And this is a metabolite that's produced by gut bacteria from tryptophan. And it is anti-inflammatory, antioxidant, and it has glucose properties. In vitro studies using human placental cells have shown that physiological levels of IPA induce changes in genes associated with normal placental function, autophagy, and inflammatory processes. And it suggests that IPA may help protect the placenta from metabolic and inflammatory insults, such as those seen in maternal obesity, potentially reducing the risk of complications like gestational diabetes and preeclampsia. This isn't a metabolite, but it's a bacterial toxin. We're going back to that LPS. So this can also impact preeclampsia. Dysbiosis can create elevated enterotoxins like LPS, because it's a lot of those pathogens that do have LPS, and they trigger pro-inflammatory cytokines like TNF alpha and interleukin 6 and reduce natural killer cell activity, impairing placental vascularization and increasing preeclampsia risk. It also influences the proportion of key immune cells in cord blood, and it may also induce changes in the fetus. So we saw that short chain fatty acids can influence epigenetic changes in a positive way. Here we have LPS that can induce epigenetic changes in a negative way in the fetus. Another metabolite that's important for fetal development is something called TMA, or trimethylamine. You've probably heard this as TMAO, which increases the risk in adults for heart attack and stroke. It's produced from dietary nutrients like choline and carnitine, so red meat can be a source here. These bacteria produce TMA, which goes to the liver and produces TMAO, and it's strongly associated with an increased risk of preeclampsia by increasing inflammation and contributing to endothelial dysfunction. This impairs the ability of the blood vessels to relax, inhibiting nitric oxide production in endothelial cells. It leads to vasoconstriction, poor placental blood flow, and placental ischemia, all of which are central to preeclampsia. It disrupts the migration and invasion of trophoblast cells, and it promotes lipid accumulation and oxidative stress. So when you're looking at TMA on gut tests, remember to look at it for your pregnant women as well, and to think about fetal development. Gut dysbiosis during pregnancy is associated with reduced myelination of the vagus nerve. The microbiome influences the formation of neurons and development of the myelin sheath, which insulates nerve fibers and enhances signal transmission. This partly is due to short chain fatty acids. It also plays a role in the hyperactivation of the HPA axis. It interferes with neurotransmitter signaling. Remember that a lot of our neurotransmitters are produced in the gut, and impacts on fetal and the ENS development. It also impacts fetal immune system and fetal regulatory T cells. This demonstrates the difference between eubiosis, that's that healthy gut balance, and dysbiosis or imbalance. On the left-hand side, eubiosis, or healthy balance with low inflammation. We have resting immune cells, we have resting microglia because we have immune homeostasis. On the other side, with dysbiosis, we have a lot of pathogens and toxins like LPS, causing activated immune cells, immune dysregulation with higher inflammation, and pro-inflammatory cytokines, leading to activated microglia. So early in the presentation, we talked about vaginal microbiome disrupting factors. Let's talk about some gut disruptions, but some of these are more specific to pregnancy and what a pregnant woman encounters including suboptimal digestion. Digestion is so important for having a healthy gut microbiome because, again, it's how we feed our microbes, and also it influences the pH of the environment and determines who can live there. So, constipation, diarrhea, and nausea are a huge gut disruptor during pregnancy. Also, prescription medications like antibiotics and antacids are given quite a bit for pregnant women. Anytime you're stopping some of the acidic production in the stomach, then we're also changing the gut microbiome because we're not killing off some of those pathogens and unfriendlies as they're moving through the stomach, and we might end up with dysbiosis in the gut. Pathogenic infections, pregnant women are more likely to contract foodborne illnesses. And then a lot of the rest of them are common in adults who aren't pregnant, but things like pesticide and glyphosate exposure, lack of diversity in the diet, the standard American diet, lack of sleep, heavy metal exposure is an important one that we may not realize that we are still subject to. But even if we eat organic, some of our foods are where they're grown, we are still getting heavy metals from them. This is a good summary slide of those metabolites in the fetal development and how gut disruption can impact the fetus. And some of these include reducing vitamin production, reducing short chain fatty acid production, reducing neurotransmitter and IPA production, increasing hexa-LPS production, and increase TMO production. And what happens as a result of this? It impacts neurodevelopment. It modifies epigenetics. It impacts the immune system development. So it is all about these metabolites. And I really believe that this is one of the reasons why we have some kids with developmental and behavioral issues that later in life, when they're older kids, they're getting their microbiome tested and their microbiome may not look that bad. And we feel like it has something to do with the microbiome. It probably does have something to do with the microbiome, but it probably happened in utero or those first 1,000 days after baby was born, and they were not exposed to these healthy metabolites, and they may have been exposed to too many of the unhealthy metabolites like TMA, and they may have had too much hexa-LPS, and this changed their epigenetics and immune system development and neurodevelopment early in life. And we don't see that now in a gut microbiome test, but it probably occurred during that period. Here's a few screenshots from a Tiny Health test to look at these metabolites. So here we see the gut inflammation markers. We do look at hexa-LPS, and we are looking at beta-glucuronidase and GABA production. We also have short-chain fatty acid production and things like IPA and TMA. So you can see these on mom's gut test. If you do it during pregnancy, you can see what she has the capacity to make and therefore what baby could be exposed to. So Emma's practitioner decided to test her vaginal and gut microbiome early on to help guide probiotic recommendations, assure mom has bifidobacteria in the gut and lacto in the vaginal microbiome, which we're going to talk about next, to support the immune system and optimize inflammatory responses, and to assure that healthy metabolites are being produced for baby. And then to catch and course correct group B strep. She wanted to help support her digestive symptoms, maybe recommend a little bit of magnesium citrate and ginger tea. And I think this is a really important point that you're not eating for two. When you are pregnant, you're eating for three. You're eating for mom, baby, and the gut microbiome. I love the Mediterranean diet for the gut microbiome through all stages of life. And to prioritize sleep and stress reduction because we know cortisol can negatively impact the gut microbiome. And then to supplement with specific nutrients that are needed. And omega-3 fatty acids we think about for brain health during pregnancy for baby, but it's so important for gut health too. It not only decreases inflammation in the gut, but it also acts as a healthy prebiotic, feeding those beneficial bacteria and supporting vitamin D. We are going to touch a little bit on group B strep throughout the presentation, and I do get asked sometimes if we do find group B strep on a vaginal gut microbiome test, can we do anything about it? And this research study shows that we can, in fact, help to reverse group B strep before baby's born if we know about it. So this study was on 110 pregnant women. It actually started 35 to 37 weeks gestation, so later in the pregnancy. And for moms who tested positive for group B strep, they were either in the placebo group or they were given 2 capsules every evening of L-rhamnosus GR1 and L-reuteri RC14. And then when they went into labor on admission, they were tested again. And Out of the 49 who completed the survey, there was a 42.9% decrease in group B strep colonization in the probiotic group compared to an 18% in the placebo group. So again, the study was done very late in pregnancy. I think that if this was done early in pregnancy, that 42.9% decrease would have been even higher. More of the women would have had a negative group B strep test upon admission. Impact of maternal gut and vaginal microbiomes on infant health during delivery, breastfeeding in the first 1,000 days. So after conception, we've gotten through the pregnancy. We want to know what happens during birth and the rest of those first 1,000 days. It's important, again, to realize that the baby microbiome is very different than the adult microbiome. And the infant gut microbiome really starts at birth when it is seeded through by birthing method and by feeding method. Hopefully, we have a vaginal birth and we're breastfed, but those are two primary ways that baby's gut is seeded. And if it's the opposite, C-section and formula fed, we're going to talk about what that does to the microbiome as well. While we do want high diversity in the adult infant microbiome, low diversity is ideal in the infant microbiome, and we mostly want bifidobacteria. Bifidobacteria is important in adults, but in adults, we want lots of other beneficial bacteria too. So it's not the primary player in the adult gut microbiome. In the infant microbiome, it does help to digest human milk oligosaccharides, which are those fibers that are in breast milk that those bifidobacteria can digest and produce things like acetate. Bifidobacteria also produces short-chain fatty acids. It competes with pathogens, and it's associated with a better vaccine response. So ideally, baby has acquired lactobacillus from the vagina and specific strains of bifidobacteria from mom's gut during birth. Here's an example of this process. We call this seeding, and this is our founder Cheryl and baby Brooklyn. Soon after birth, both Cheryl and baby were tested to see how many of the microbes Brooklyn had acquired from mom and how many from the environment. And you can see here in the blue, most of them came from mom. Very little of them came from environment. So baby truly is seeded through birthing method and through feeding method right from the beginning, as well as from their environment. We're going to talk about breastfeeding and why it is so important for baby's gut microbiome. But one of the reasons why is that because bifidobacteria, breast milk, comes partly from bifidobacteria in mom's gut. And I wanted to make sure I explain that mechanism because it's really interesting how these like dendritic cells, for example, there's several different theories on how this happens, but one of them is that dendritic cells, which is this purpley spiky thing with this long arm, it reaches through the intestinal barrier, it grabs onto these microbes, these bacteria, and pulls them back in. So one theory is that it does this, it enters the lymph system, and it travels to the breast milk. So this bifidobacteria in breast milk is essentially coming from mom's gut. So it's really important that mom has bifidobacteria in her gut. Now, if you have a C-section delivery, then we would expect that you would have a higher diversity in baby's gut, that you would have more bacteria that resemble the environment that are a little bit more pathogenic. In a vaginally born baby, we have more bifidobacteria. And formula-fed versus breastfed is very similar to C-section versus vaginally born. With breastfed babies, we have higher bifidobacteria, and formula-fed, we have more of those pesky, kind of opportunistic, pathogenic microbes. The good news is studies looked at what happened if you were born C-section and then you were breastfed. And a lot of times, the C-section microbiome could be compensated and could be restored by breastfeeding. But there's one really big catch. That cannot happen unless mom has bifidobacteria in her gut, because the only way for that microbiome to be restored through breast milk after C-section, if mom has bifidobacteria in her gut that is going through her breast milk and into baby. So super important to test breastfeeding moms to make sure they have enough bifidobacteria in their gut. Back to group B strep, because there's three really big gut disruptors for infants: C-section, delivery, formula feeding, and the other one is antibiotic exposure. We know that testing and treating group B strep is essential because it can be life-threatening for babies, but we need to know what's happening when baby's born and they're being exposed to penicillin during birth. And it will decrease the amount of lactobacillus in mom's vaginal microbiome and bifidobacteria in baby. So essentially, what are the two things that we want to happen when baby's born? They're exposed to lactobacillus and vaginal microbiome, bifidobacteria, and mom's gut microbiome. That's not happening when mom is on penicillin and baby's being born. It's important that we know that so we know how to correct it. It's also important that we test mom for group B strep early on in her pregnancy, and that we can use our protocols and retest and hopefully eliminate that group B strep before baby's born and before mom has to have penicillin. So here are a few more age-adjusted metrics that I want to show you. HMO digesting species, we measure these in pregnant women and in infants, and HMO digestion in infants. And we have a microbiome maturation score for baby. It's really important that their microbiome matures at a certain rate, because if it doesn't mature enough, it won't train the immune system properly. If it's maturing too fast, it won't train the immune system properly, and vice versa if it's not maturing fast enough. So we need to be within this range. And here we have a 4-week-old baby that looks like their microbiome is a 5-month-old, and that falls within the healthy range. Having any issues during this maturation process can really set us up for immune system dysfunction and atopic March conditions. Same with the C-section signature. Here we're looking at if baby has the same signature that we typically see in babies born C-section. They usually have higher diversity, more pathogens, bifidobacteria. And if we have a high C-section signature, then we could also be setting ourselves up for atopic March. You don't have to be born C-section to have this signature. Any of those gut disrupting factors could impact this. So when baby's born, we have a few options of when to test, but usually we want to test within those first 4 weeks, and it's going to depend on the birthing experience and on mom's microbiome. Ideally, baby was born vaginally, breastfed, and we knew that mom had a healthy gut microbiome and vaginal microbiome because we tested her. In that situation, we would test at 4 to 8 weeks old. However, if this didn't go the way we wanted, and maybe we had a C-section delivery, formula fed, baby was in the NICU, or we don't know what mom's microbiome looked like, we would want to test earlier on. Or even if baby did have everything go perfectly, but they were having symptoms like some gassiness and colic, we would test earlier on. For a protocol, we're big believers in boosting gut commensals first and assuring that mom has enough bifido if she's breastfeeding. We also want to make sure we have enough HMOs. Some formulas do have HMOs, but they don't have as much as breast milk, so we may need to supplement with additional ones. And one trick that we have for if we see some pathogens in baby's microbiome, then if mom is breastfeeding and she includes some specific spices in her diet, it could reduce those pathogens in baby. But it's very important to remember that the infant gut is really malleable and sensitive to probiotics. In adults, we can take probiotics for years and not make much of a difference in the gut microbiome, but for babies, it only takes a few weeks. And it's really important to track, because if we oversupplement babies, it prevents that healthy gut maturation process, which is really important for the immune development. So here's a really good cheat sheet for you that tells you it's our recommendations for how long to start supplementing babies at different ages. And these are just guidelines. It's always important to retest after a little bit to make sure that we're on the right track. So as Emma approaches her late 40s, hormonal fluctuations begin. Estrogen declines, leading to a decrease in vaginal lactobacillus and a rise in pH, making her more susceptible to UTIs, dryness, and discomfort. She shifts to a non-lactobacillus community state type of 4, which has increased Gardnerella and Prevotella and increases her risk of infections. The reduced estrogen recycling increases her risk for metabolic and cardiovascular issues, and she has reduced gut barrier integrity, which increases microbial translocation and increases inflammation. Emma notices changes in her mood, sleep, and metabolism symptoms linked to both hormonal shifts and microbial changes. And some of these symptoms that are common during menopause can be traced back to the gut and vaginal microbiome and how they're interacting with hormones. So back to the estrobolome. During menopause, declining estrogen and shifts in the gut microbiome composition, including reduced lactobacillus and increased Prevotella, can disrupt the estrobolome, leading to less estrogen recycling and lower circulating estrogen. And this imbalance is linked to increased risk for osteoporosis, metabolic syndrome, cardiovascular disease, and vaginal atrophy in postmenopausal women. So what can you do about the estrobolome at this stage? We know that a lot of times the estrobolome can be made up of a little more pathogens and opportunistic. So we don't necessarily want to increase them. However, we also know that a lot of times it's just reduced diversity overall. And going back to one of those very first slides that I showed you, as we age, we have less diversity in our gut microbiome. So this less diversity in the gut microbiome at this age could play a role in less of that estrobolome activity. And if we could increase that or boost that a little bit, it could help with some of these menopause symptoms. So just using some tips and tricks in your toolbox to increase that diversity could help with the estrobolome. You want to make sure that you have those beneficial microbes, but that you're feeding them well with a wide variety of fibers and plant foods. Post-menopause, Emma's microbiome has permanently shifted. Vaginal diversity increases, but lactobacillus declines and the gut microbiome changes do persist. She experiences symptoms like dryness, increased infection risk, and metabolic changes. Emma uses targeted interventions like diet, probiotics, and possibly hormone therapy to support her microbiome and reduce symptoms. And here's a table of some different treatments that have been shown to improve the vaginal microbiome and lactobacillus during this time period, including topical estrogen therapy and systemic HRT, which increases lactobacillus, hyaluronic acid supplements or suppositories, which improve vaginal atrophy, pH, and tissue health, and using lactoferrin along with lactobacillus. Lactoferrin almost acts as a prebiotic for lactobacillus, the vaginal microbiome. When you take lactoferrin and lactobacillus both orally, can promote lactobacillus in the vaginal microbiome. Targeted probiotics, specifically Rhamnosus GR1 and L-Reuteri RC14, have been studied during menopause to show improvements in the vaginal microbiome. And that leaves us with using microbiome testing as standard of care. At Tiny Health, we really believe that all women should have access to this testing during pregnancy in the first 1,000 days to set their baby up for optimal neurodevelopment and immune development. So we recommend that women that are trying to conceive do both a gut and vaginal test. And it's a good idea to check men's gut microbiome as well. Pregnant women, it's really important to optimize those microbes and their metabolites for fetal development, and to ensure that bifido is in the gut and lactobacillus is in the vaginal microbiome to seed baby during birth, and to screen and address group B strep early on. Also, we want breastfeeding women to check their gut microbiome to make sure they have enough bifidobacteria, and then infants starting around 4 weeks old, and then again at about 4 to 6 months old and 9 to 12 months old. These are really important milestones in gut maturation and for that immune training during the first 1,000 days. And then anyone who is exposed or has some of these gut or vaginal disrupting factors, they should be tested again. And definitely if they have symptoms, even if they don't know they've been exposed to these gut disrupting factors and they start to have symptoms, we want to make sure we're course correcting. And it's a great idea to do for anyone for annual wellness. And one of my favorite reasons to do that is because sometimes we may not think we have any gut disruptions, vaginal disruptions, but we do a test and we find something. And while we haven't had symptoms yet, if we reverse and course correct at this point, then hopefully those symptoms never emerge. So we can catch things before they come out as symptoms.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.